The Anna Westin Act of 2015 is named to honor the memory of a wonderful, creative, and kind young woman. A wonderful, creative, and kind young woman whose life was lost due to an eating disorder illness, and to be clear, due to inadequate access to care.
The Anna Westin Act is of paramount importance because it provides training for physicians, healthcare professionals, school counselors, and the general public to identify eating disorders early on and access the right level of care at the right time. Today, we are thrilled to welcome United States Congressman David Price, who is one of several bipartisan co-sponsors of the Anna Westin Act, to Veritas Collaborative to learn more about eating disorders treatment.
Eating disorders are kind of a hidden illness. It affects thousands and thousands of people, young people, also adults, and yet when those people seek treatment, often they have hassles with insurance coverage, and they're not adequate trained personnel or facilities to deal with eating disorders.
So as the medical provider here at Veritas, I see an inordinate number of kids who come in super sick. And it's because they're not recognized because medical providers don't have the training. Pediatricians, when they get trained, in 3 years of residency, they get 5 hours of training about eating disorders. Child and adolescent psychiatrists, they get training for 5 years, 5 hours about eating disorders specifically.
The Anna Westin Act, it's aimed at two major things. One is training personnel, making sure that medical professionals are educated about eating disorders. Secondly, we're talking about insurance coverage, and in particular making sure the provisions that are in law already with respect to mental health being treated on a parity with physical disorders, make sure that it's clear that that applies to eating disorders.
As it stands right now, there are limitations to the Mental Health Parity Act, and we really need to clarify those limitations because residential treatment is just such an issue, and it's so important in making sure that our patients are getting the services that they need.
I think we need to improve the treatment. We need to increase public awareness. So this is something that people who understand it and are dedicated to the cause need to give continuing attention to.
Many refer to the Anna Westin Act as Anna's Law, and I can tell you that Anna's Law is absolutely unprecedented. It's the first time in the last 10 years that a bill of eating disorders has held bipartisan support in the U.S. Congress. Together with the Eating Disorders Coalition, the Westin family, and other advocates from around the nation, we will continue to advance this cause on Capitol Hill, and we will attend to this legislation all the way to the President's desk. This is our mission. Together, we can do that. Together, we will do that.